Dear colleagues, today I will present a case of severe scoliosis associated with a neural tube defect in the first trimester. This is a very interesting case because it demonstrates how, when faced with a marked abnormality of the axial skeleton, one must always conduct a meticulous search for signs of open spina bifida. To start our analysis, let's begin the examination from the cephalic end, where in the axial scan we can identify and observe the presence of the so-called crash sign. That is, the caudal displacement of the midbrain, which impacts, hence the term crash, against the clivus surface of the occipital bone. And this process occurs primarily due to the continuous loss of cerebrospinal fluid at the level of the spinal defect, which drags both the cerebellum and the brainstem downward. When we shift to the median sagittal scan, we can clearly observe another indirect sign of this same phenomenon, which is the absence of the so-called intracranial translucency. As a matter of fact, as you can see, those three anechoic spaces that we would normally expect to see in a healthy fetus at this stage are completely absent from the view. And these correspond to the brainstem, the intracranial translucency, and the cisterna magna. This is precisely a direct consequence of the leakage of cerebrospinal fluid that occurs because of the presence of an open neural tube defect. Moving forward in our assessment, facilitated by the use of transvaginal ultrasound, we begin a detailed study of the spinal defect. In these clips, you can analyze an extreme lumbosacral scoliosis, presenting almost at an acute angle, and we can also notice not only a deviation of the axis, but a true complex disorganization of the ossification centers. And at this point, as you can see, indicated by the arrows, the vertebral bodies lose their regular parallel alignment and enter into a complex malformation that may suggest the presence of hemivertebrae or an extensive defect in the closure of the posterior arches. And it is precisely the extent of this cleft that explains the severity of the intracranial signs we saw a moment ago. The massive herniation of the rhombencephalon is, in fact, directly proportional to the amount of cerebrospinal fluid loss. In the coronal plane of the ultrasound scan, you can appreciate even more clearly the full extent of this spinal defect, as you can see how the axis of the spine is not just curved and deviated, but actually undergoes a significant and unmistakable interruption of its linearity. As for the detailed study of the remaining fetal anatomy, we can observe a completely normal scan of the abdomen, with the stomach clearly visible. The situs is solitis. The study of the cardiac anatomy for this gestational age is within normal limits. The detailed examination was performed both transabdominally and transvaginally, also using color Doppler imaging. A normal 4-chamber view, a normal 3-vessel view, and the normal crossing of the great vessels were all clearly observed. Further anomalies were found in the urogenital system, as you can see in this clip, there is a single kidney with normal biometry and echogenicity, and throughout the entire duration of the exam, which lasted well over 30 minutes, an adequate filling of the bladder was never observed. Finally, I would like to highlight one last point, namely the finding of a biometry that was about 1 week behind, even though about a month earlier the patient had undergone an ultrasound in which the CRL matched the gestational age based on amenorrhea. The clinical management of the case requires thorough counseling for the couple, with a request for genetic consultation, which is fundamentally important for calculating the risk of possible recurrence in future pregnancies. In the event that the couple decides to proceed with a voluntary termination of pregnancy, it is strongly recommended to carefully collect and preserve fetal fluid for soma testing, to perform a detailed X-ray for a more careful and thorough documentation of the spinal defect, and wherever possible to conduct a full autopsy. Thank you all for your kind attention.